I found you guys on YouTube at first, and then I wanted to come here like back in January of this year, and I ended up having time, and I'm here.
Hey guys, it's Dr. Emer. We have a patient of mine that has some acne scars. First treatment and doing a combination today. And if you look at his scars, a lot of these are boxcar scars. There's some ice pick ones. When he smiles, go ahead and smile as big as you can. Some of these come together, which means that they're going to be really good for filler, but some of them still remain. And those that remain, we need to laser and we need to see how much they improve, because if they don't improve a ton with laser, then the only treatment left is punch excision. So today we're going to do a combination of using filler, our PMMA to build that long-term collagen, and laser in combination to resurface the skin. Come take a look. So we're going under some of these boxcar deep atrophic scars and doing small aliquots of our PMMA with mixed with collagen. This is going to help not only build collagen in these scars, but also do a little bit of a needle subcision. Most of these scars respond very well to laser, so we're going to see what the combination of doing the injection plus the lasering will do. We're doing some TCA cross where we use our toothpick and a strong chemical to help get the deeper acne scars to fill in. You can see pretty much on immediate use, there's frosting that's starting to occur. You can see that here. We want to underdo this, the first treatment, because this is going to help these areas fill in. And you don't want to overdo it and worsen or widen the scar. So now we're doing nerve blocks. This is going to help make the pain of both the halo and the CO2 much less. You can see the TCA cross has already been performed. There's frosting going on in the scars. Now we're going to numb the area and get him ready for the big laser treatment. We are now doing halo. This is our hybrid fractional laser. We're hitting it from two levels, you guys, two wavelengths, going to the deep level to build collagen and remodel some of those scarring, the deeper indentations, and also the superficial portion, which has all these little dots, is going to peel and to make the skin on the surface much more smooth. The goal is to really remodel some of these deep scars. He has a lot of textural issues. Forehead is more blending to the rest of his face. The majority of the issues are on his cheek and temple. All right, we're now doing our final part, our CO2 resurfacing. We've done our TCA, we've done our Bellafill, we did our hyperfractional laser. He has these very deep, sort of rolling atrophic scars on his cheek and temple, so we really need to be aggressive here. Obviously, with a darker skin tone, we're a little more careful to risk of hyperpigmentation, so he's really going to follow our skincare plan. But we are doing a deep laser first. This is going to go a lower density, but much deeper to try and remodel some of these scars. Then we're going to go right over this with the more superficial laser. This is the more superficial laser. We're doing acne scar resurfacing. We really want the skin to remodel, and we want it to heal very quickly without risk of much hyperpigmentation or redness. We're going to use our PRP. We're going to get that on his skin. Again, this is growth factors from his own blood with stem cells and exosomes to help him heal. So we're going to apply this everywhere, cool him down. Our PDO Afterglow, right here, you guys can see a much thicker serum. This is that hyaluronic acid mixed with 1,000 smooth threads. This is going to build collagen. This is going to help him heal. Now the next part, to really infuse all the products, we're going to do our Emer Skin Intense Hydration Mask, peptides, hyaluronic acid, licorice root, tea tree, and botanicals. You can even combine that with my botanical serum, my botanical enhancing serum, which has all the extracts needed to calm the skin down.
It wasn't too painful, but it's bearable. I'm just so numb right now. Like somebody just beat me up. Day 2, a little swollen still. Starting to scab a little bit.